Hypoxia is classified by its cause. So let's now think about the causes of hypoxia. And the first cause is extrinsic. This is factors outside of the lungs, factors in the atmospheric air, and indeed factors that allow the air to be moved in and out of the lungs before the air actually gets to the lungs. That would be extrinsic hypoxia. The next cause is pulmonary. And pulmonary hypoxia is anything wrong with the lungs themselves. Any trauma or disease process affecting the lungs would cause pulmonary hypoxia. Now, of course, once the oxygen is absorbed into the blood, it must circulate around the circulatory system. So we need two things here. First, we need the ability of the blood to transport the oxygen, and then we need the oxygenated red blood cells to move around the body. And if there's an insufficient oxygen carrying capacity of the blood, usually because there's something wrong with the red cells, we call that an anemic hypoxia. If there's a problem with the circulation, we call that a stagnant hypoxia, that the blood is not circulating around. There's a relative stasis of blood or tissue fluid. And of course, finally, the oxygen goes into the cells where it's used by the mitochondria. And if for any reason the cells themselves or the mitochondria are unable to use the oxygen that is delivered to them, we call that a histotic hypoxia. So here we have classification of hypoxia is according to its cause. Extrinsic, outside the lungs. Pulmonary, within the lungs. Anemic, relating to the ability of the blood to absorb the oxygen. Stagnant, relating to the ability or the inability of the blood to transport the blood around the body. And histotic, relating to the tissue cells themselves, if they are unable to use the oxygen for whatever reason. And we can relate this to the oxygen chain physiology that we've just discussed. Let's do this on this diagram. Remembering the oxygen chain, so we need oxygen in the air, which is present at 20.84% in fresh air. Then we need the action of the chest wall and diaphragm, and we need patent respiratory passages. And notice that these are before we actually get into the lungs. So anything going wrong with these systems here would constitute an extrinsic hypoxia. Then we need the function of the alveoli and the surfactant and the wall of the capillary. These will constitute a pulmonary hypoxia. Now, where you include the airways is somewhat subjective, so I'm going to overlap that. So, pulmonary hypoxia would affect the lung tissue itself or the airways. Probably the best definition actually is extrinsic would be the large airways, the upper airways. And then it's a pulmonary hypoxia if it's affecting the smaller airways, which are actually within the anatomical boundaries of the lungs. Next we need the red blood cells, which of course carry the hemoglobin, the oxygen carrying pigment. These must be present in adequate numbers and be healthy, otherwise there's going to be an anemic hypoxia. I mean, the best definition of anemia actually is a reduced oxygen carrying capacity of the blood. Next, we need the blood to be able to circulate around the body. So we'll need adequate venous and arterial circulation. The oxygen must be able to diffuse through the capillary walls from the blood into the tissues, and the tissue fluid must be able to transport the oxygen from the capillaries through to the tissue cells themselves. So this classification would be the stagnant if any of these go wrong. That one's stagnant. This one was the anemic. This one was the pulmonary. And then finally, the tissue cells must be able to use the oxygen that's delivered to them. the mitochondria must be healthy and able to utilise the delivered oxygen. If not, there will be a histotic hypoxia, the final classification. So, extrinsic, pulmonary, anemic, stagnant, and histotic causes. Hypoxia is classified according to its cause. Let's now relate this to the diagram that hopefully we are already familiar with. So oxygen in the air, large airways, chest wall and diaphragm, main airways, and this was a diagram of the chest wall, remember. So all of these things will constitute extrinsic hypoxia before the oxygen gets into the lungs. If there's not enough oxygen in the air, the large airways are blocked, the chest wall is not moving properly, that will be a cause of extrinsic hypoxia. Next we thought about pulmonary hypoxia, and that will be disorder in the lungs, and it will be disorder in the alveoli, the small parts of the lungs. And as we said, there's an overlap here depending on how we classify the hypoxia. If it's large airways, we'll count that as an extrinsic hypoxia. If it's smaller airways, we'll count that as a pulmonary hypoxia. Next, we must have the ability of the blood to absorb the oxygen into the haemoglobin. Anemia would be a cause of hypoxia. After this, the blood needs to circulate around the body. This was the circulatory system and the tissues. And remember, this was the fluid within the tissues. So if there's not a good circulation of the blood, or there's something wrong with the tissue fluids, there will be a stagnation in fluids leading to a stagnant hypoxia. Finally, the mitochondria must be able to use the oxygen that's delivered to them in the process of cellular respiration. Anything wrong at this level would lead to an histotic hypoxia. So hypoxia can be extrinsic, pulmonary, anemic, stagnant, or histotic.